You've probably heard that you should never sleep in your contacts. In fact, it's one of the riskiest activities you can do with your lenses. But why? I'm going to break it down so you know exactly what happens to your eyes and how big the risks are. Hi, my name is Dave Allamby and I've been an eye surgeon for 35 years and performed around 30,000 laser eye surgery procedures. I have seen the damage that sleeping in contact lenses can cause, but it wasn't always this way. Historically, bacterial infection of the cornea appeared to be rare, but has become common driven by the wide-scale adoption of hydrogel contact lenses beginning in the late 1960s. So if you jump back in time with Marty McFly, before contact lenses, you might be hard-pressed to find a case of corneal abscess. Let's jump back to the future. Contact lenses today are very, very popular, with over 140 million wearers worldwide and 45 million wearers in the US alone. However, over 99% of contact lens wearers, when surveyed, reported at least one behavior that puts them at risk for a contact lens-related eye infection. Sleeping in lenses is one of the riskiest, and it's pretty common. 1 in 3 contact lens wearers reported sleeping or napping in their lenses. That was 1 in 3. Now, research shows that going to bed with your lenses increases the risk of eye infections by 6 to 8 times, including potentially sight-threatening complications. And it's a risk factor regardless of lens material and frequency, and with even occasional overnight use conferring risk. But why did eye infection of the cornea used to be rare? Well, under healthy conditions, the surface of your eye is endowed with a complex defense mechanism, which is remarkably effective at preventing corneal infection. We know that your tears have a wide spectrum of activity against all kinds of invaders, be it bacteria, viruses, fungi, or protozoa, and they contain over 1,500 different proteins. One of the most common and serious bacteria that causes contact lens related infections is called Pseudomonas aeruginosa. It's a nasty infection, but curiously, in a healthy eye and ocular surface, you can pour Pseudomonas right on the cornea with very little effect. Researchers confirmed that the eye will shrug it off, at least in an animal model. Shortly after the commercialization of contact lenses in the 1960s, Pseudomonas gained notoriety among ophthalmologists as a particularly virulent pathogen, which was capable of causing perforation and blindness within 24 hours of symptom onset. The most common belief is that it's all about oxygen deprivation, where the contact lens blocks oxygen getting through, but there's more to the story. Despite high hopes, the introduction of high oxygen permeable silicone hydrogel lenses in the late 90s has not reduced the incidence of contact lens related infections. So, if it's not about oxygen, what problems do contacts cause? Well, once you wear a contact lens, many things start to change. The lens creates an unstable tear film and reduces the turnover of cells on the surface of your eye, which increases the opportunity for bacteria to adapt and invade, and it disrupts the immunity of your ocular surface. These factors may help explain the explosive emergence of Pseudomonas as an opportunistic pathogen that doesn't otherwise infect the eye. Prior to Marty McFly in 1965, there were only 100 cases of Pseudomonas corneal infection reported in the literature. Now, in the US alone, infectious keratitis accounts for 1 million annual physician encounters and 250,000 hours of clinical care due to some form of keratitis. Contact lenses are relatively safe and effective when used correctly, but this means following all the guidelines for wear and care. If you're tempted to sleep in your lenses, remember that the risks simply aren't worth it. Always remove them before bed and avoid shortcuts with your eye. Or if you're thinking about switching to laser eye surgery, watch this video next.